Hello again, my name is Georgios. I'm a fourth year medical student at the University of Birmingham. I am the current Vice President of the Surgical Society and President of the Greek Society. Today, in this brief, I don't have much time, so I'll be very brief. In this brief sort of video, I'll talk to you about how medicine is at Birmingham, how the University of Birmingham is as a whole. I don't do much editing, so don't expect much, but I'll try to give you all the necessary bits and bobs of what it is to study medicine in Birmingham, and I'll give you some examples of that you can also find on our website. Now, medicine in Birmingham is 5 years. You can do an extra year as an intercalated degree. The extra year is optional, obviously. I haven't done it, but some of my friends have, and they get a master's by doing that. Now, the first 2 years, you're a proper scientist. You are at the university, you're like a proper science student. You wake up and have your lectures usually from 9 to 5, but there's great variation in that. Sometimes you only have one lecture in a day, one practical session, but sometimes the whole day it's full of lectures. So it very much depends on exactly what each day holds. But usually, yeah, it's 9 to 5 in the first 2 years. Now, from the third, fourth, and fifth year, you are a proper clinical student. So you are all day at the hospital, with some exceptions. The exceptions are that we have the community doctor, the general practitioner, where we train sort of every 3 weeks or so in both first, second, third, fourth, and fifth year. And yeah, so we also have some odd lectures here and there at the university, but it's kind of rare, I would say. Perhaps 2 or 3 times a month we actually have to go to the medical school as clinical students, and that's usually just a dedicated reading week period, although we have some lectures there. Now, how is first and second year? And how is life here in Birmingham? So in the first year, usually we offer people, our students, we offer them accommodation, and that's either at the Selly Oak area or by the Vale Village. The Vale Village is very beautiful. It's by the lake, beautiful nature and stuff, but it's 20 minutes away from the medical school, versus the Selly Oak sort of accommodation location is only 7 to 8 minutes by foot. So very close. I chose the Selly Oak area for the reason of the proximity. Now, both the locations are excellent, but the Vale is more beautiful, but at the cost of having to walk more every day. It's a personal choice. Now, in first year, we start going to our general practitioner placement, our GP placement, and that's every sort of. I think I started on the second week of the year. Now, obviously, that's subject to change. So what I'm saying now might not be applicable to you, or might be changed in some way. You can find all of our details, all the university details on our website. That's birmingham.ac.uk. Now, let's talk a little bit about how the university is structured. So the first couple of years, as I said, you're at the university primarily. You go to the general practitioner. We have a lot of anatomy training, a lot of academic skills, so reading a paper, academic paper, understanding it, critiquing it, and applying the knowledge. In the first semester, we have genetics, a bit of biomedical science, a little bit of histology, and a little bit of embryology as well. That's in that module. We have the endocrinology, pharmacology, and histology module as well. Then we have the neurology and sort of neuroscience module as well, where it's very much a scientific approach to how the neurons work, how reflexes work, how our brain is structured in the cellular level. And then we always have, in all semester 1, 2, 3, and 4, so in the first 2 years, we have a module each semester that's on ethics and law, so and communication. So as a doctor, communication and ethics are critical to what we do, very important what we do. Now, in semester 2, we have the musculoskeletal module, so that's a lot of, all the anatomy of the muscles, how they work, each of the joints of the human body. That is all the extremities, but also a little bit of the spine and the neck and so on. So everything that moves, basically, we study in that module. Then we have the respiratory module, so everything about the lungs and how they work, the physics, the physiology, and the pathophysiology, so the pathology that can be associated with certain lung diseases like asthma, like COPD, and so on. We have our digestive system module, which is the science behind everything having to do with the alimentary canal, with the digestive system. And we also have, as I said, the module on ethics, law, and a little bit of science as well, of study design and so on in the second semester. Now in the second year, also we have an essay as well in the first year. I think 1 or 2 essays, or sorry, 1 essay and 1 poster presentation. Now in the second year, but that subject could change, of course. Sorry. Now in the second year, we have again 2 modules, 2 semesters. We have the cardiovascular system, we have the immunology, infection, and hematology module. We have the renal medicine module, again the physiology and pathophysiology, and so more of the science behind the clinical sciences. And we have again the public health, law, and ethics module as well. And we have a year-round, as we said previously, year-round anatomy and GP placement and the academic skills modules as well. So second year is a bit harder than the first one, but still, if you keep on top of it, you will have no problem with passing your exams. Now, year 3, 4, and 5 are the clinical years. After year 3, you can take an intercalation. After year 4, you can take intercalation, but that's usually how it goes, 3, 4, and 5. Now, in year 3, we have where every day at the hospital, we have placement at the hospital. We have various modules, like which I'm sure I will miss some of them, but namely some of them are the cardiovascular system, and that's proper medicine, so management, diagnosis, everything, investigations. We have elderly care, we have general surgery. General surgery is a module by itself, and vascular surgery is another module, for example. And then we are placed in the theatres, so we have a lot of surgical teaching in the third year, and it's mainly surgery and the wards. It's one or the other, and we don't really have clinics in third year as much, but it's mainly surgery and the ward experience. But again, that's subject to what you like as well. So there are opportunities that you can get for doing on-calls, for doing extra work here and there, but that's really up to you. We have the diabetic module, we have the biliary surgery, upper and lower GI surgery, and gastroenterology. We also have some year-long modules like pathology, the basics of the science behind pathology, infection, antibiotics, and so on, and a bit of child development as well. So that's the third year. And again, we have some more, we have an exam on statistics and a little bit of that, but nothing too demanding from that statistical point of view and mathematical point of view. Now, year 4 is what I mean. I'm currently in year 4, and how that works is we have primarily clinics in year 4 where we see patients. It's mainly the doctor seeing the patient, and we sort of try to learn from that for most of our modules. But we have our general placement module, not general placement, I do apologize, the general practitioner, sort of CPM, community-based medicine module, where actually we have our own student clinic, and patients come and they see us. So it's either myself and usually myself and a colleague in the room, and we take a history from the patient, we examine them, we come up with a management plan, perhaps in this case approved by the doctor. So first we see the patient ourselves, and then the doctor comes in and we ask him any questions we have, and perhaps we show the doctor our plan, and then they do hopefully approve of our plan, and that concludes the interaction with the patient, and that's sort of a lot of freedom there, a lot of responsibility and freedom as well. Excellent. So in third year, what modules do we have is the question. We We start with our surgical and anesthetic placement. So we do a lot of anesthetics, a lot of ENT surgery, some breast surgery as well. We observe that. We have whole neurology placement, so neurology, strokes, neurosurgery. We have palliative care and so on in that block itself. We have the orthopedic placement, so at the Royal Orthopedic Hospital we have whole dedicated teaching on that, on how to examine and how to manage fractures and so on. We have rheumatology rotations, we have hematology rotations, oncology, we have a whole medicine block of dermatology, as we said, oncology, hematology, a lot of the sort of chronic condition clinics, and I forget some of them, but yeah, we do have a lot of that sort of teaching. And we have a psychiatry placement as well. So we have the Oliester Hospital and the Barbary outpatient hospital as well, and actually there we practice our psychiatric histories and the management of patients who suffer from these conditions and so on. So you get a very, very good experience of medicine. In year 4, you're more independent, you're more confident, you're more of you're preparing to become a doctor. Now in 5th year, we have again even more confidence, more competence, and we spend our time in the emergency department in ICU. We do a little bit of sort of acute medical care, acute surgical care, but mainly medical in the A&E department, as I said, in the ICU. Then we go to the pediatric rotation. We have our our GP placement, which is I think a month and a half or 2 months, but that's subject to change again. And in that rotation, we actually we have our own clinics again, and similarly we're supervised by the doctor. Usually it's one student in the room, and the doctor comes and the patient comes and you take a history exam and come up with a management plan, and then the doctor approves of it. Now, the last thing we have is the pediatric placement, which is again where you see conditions presenting in children, the management, the investigations, the diagnosis, and so on. Excellent. So throughout the clinical years, we have examinations that involve the doctor in charge having a look at us examining patients and then giving feedback to us. So that's one part of the assessment. And we also have clinical skills that we need to do. So in 3rd year, we put little tubes in people's veins called the cannula, among many other things. In 4th year, again, among other things, we also do a urinary catheterization. So for people who cannot urinate themselves, we help them with that. And in 5th year, we do, again, all of the previous, plus some more advanced skills like, I believe, arterial blood gas. So when you take collect blood from an artery. So yeah, this is sort of the basics. I'm sure I miss a lot of it, but it's such a big topic to talk about. I don't want to take too much of your time. Hopefully you found that useful. Hopefully you choose Birmingham. Absolutely, if I had the choice again, I would 100% go for Birmingham. Some other alternatives are Oxford and Cambridge. I think these are nice places with campuses and stuff. Cambridge is very, and Oxford a bit more busy. Birmingham is the campus itself is more peaceful, more quiet. But again, busier than other places like Leicester, where it can be quite quiet. So Birmingham, 100%. I absolutely recommend. I love my time here, and I highly recommend you join. If you like the video, click a like, subscribe perhaps if you want to see more content like this, and share it with anyone who is interested in coming to Birmingham and studying medicine or any other course here. So thanks so much.